You may be feeling fine with no pain and no damage, but right now your blood vessels could be getting damaged. Today we are looking at the silent damage of hypertension. So what is blood pressure? So your heart pumps blood against your heart pumps blood to the vital organs of the body. Now, the force that the heart uses to pump blood against the blood vessels is what we call the blood pressure. Now, we have what is the normal and the high blood pressure. Normal blood pressure is around 120 out of 80 millimeters of mercury. High blood pressure is anything that is above that. So, there are people who have blood pressure of more than 130 out of 80. So there are different categories and how we group the hypertensive patients. Then the heart usually pumps the blood in a continuous manner. The cardiac cycle is always a continuous process. There's no single time that the heart stops pumping the blood, and balance is essential at this point. A balance between the blood that is supplied throughout the body is essential. Now, why does pressure stay high? Now, this happens due to the constant vessel stress. Now, if we look at the blood vessels, we have the inner lining and the outer lining. Now, if we look at the inner lining, what happens is that the walls or the walls of the blood vessels becomes weak with time, and as they become weak, the vessels get stressed. This leads to reduction in the elasticity of the blood vessels, their ability to expand, and the damage usually starts silently without any warning signs. So what is it that happens within the blood vessels? As the blood vessels constrict due to diseases like atherosclerosis, what happens is that the walls become weak. The walls will become weak. This leads to the due to the constant supply of blood that is needed within the body, it leads to stress within the vessels as the heart struggles to push uh, the blood throughout the body. So here we can see the multiple causes of arterial stiffness with aging and diseases. So here we have number one, increased collagen deposit, advanced accumulation of uh, glycation end products. Then we have decreased elastin, which means that the elasticity of the blood vessels decreases. Now, what happens is that we have blood vessel damage. So with the blood vessel damage, what happens is that as the as there is a constant need for the supply of the blood throughout the body, there will be tiny cracks within the vessels. And with the tiny cracks as they develop, there is fat deposit, there is cholesterol deposit within the inner parts of the vessels. This leads to the narrowing of the arteries, and this is what we call atherosclerosis, which means that the blood vessel, its elasticity decreases and it becomes narrow. It becomes narrow due to the deposit of the cholesterol within the inner parts of the blood vessels. This will lead to a decrease in the blood flow. This will lead to decrease in the blood flow. Now, the heart is usually under stress. What happens is that the heart normally pumps blood. The cardiac cycle is usually a normal process, but with the increase in the blood pressure, the pumping of the blood becomes difficult. Why is it? It is because of the constriction of the blood vessels, which means that the heart will have to work much under pressure. It will have to pump more blood with a greater force in order to supply blood to the body. And what happens is that the heart will increase in size, what we normally call the left ventricular hypertrophy, because remember, it is the left ventricle that is responsible for the pumping of the blood throughout the body. And with the left ventricular hypertrophy, uh, as it happens in the first place, you can say that it is a normal process or a good thing, but as it continues, it may lead to conditions like heart failure. The blood flow uh, throughout the body within the constricted vessels makes the heart to work under pressure. And with the brain effects, now the brain rely on the blood that is supplied from the heart. And with the decrease in the blood that is supplied to the brain being one of the most vital organs, decrease in the blood supply to the brain will lead to ischemia or death of the brain cells. Usually, you can start by seeing it in form of loss of consciousness, memory problems, and also some headaches. And what happens is that we have the tiny blood vessels of the brain. With the decrease in the blood supply, and also with the blood being supplied under high pressure within the narrow vessels, it can lead to damage of these tiny vessels, and this may lead to stroke. This is a very, very bad problem to the brain. It will lead to brain problems like stroke. And the bad thing is that these problems are usually noticed after a long period of time, after a major event like a stroke has happened to the body. Then we have uh, eye damage. So the blood vessels to the eye are also delicate, and with the increase in pressure, it will cause damage. This usually happen, and it is usually called hypertensive retinopathy, which means with the increase in the blood supply within the constricted vessels, it will lead to high pressure, which will cause damage to the eye vessels, and this will lead to blurring of vision, and the changes, if they go unnoticed, may lead to the risk of losing the vision. Then with the kidney damage, the main function of the kidney is to act as a filter. The filter, it acts as a filter of the waste products uh, and the good products that should remain within the body. So it acts as a filter, filtering the waste products to be excreted through the urine. So what happens with the high blood pressure is that with the narrowing of the vessels, there's decrease in the blood supply to the kidney. And the kidney needs the blood supply in order for the waste products to be filtered and excreted. And with the damage of the blood vessels, there's waste buildup, the buildup of the waste products within the kidney. This leads to fluid retention. This will lead to retention of the fluids within the body. And what does that do? It leads to risk of kidney failure. And usually before the kidney failure, it will lead to chronic kidney disease. And with the chronic kidney disease and with chronic kidney disease, it may lead to uh, the patient going under dialysis for maintenance. But if that go unnoticed, it may also lead to kidney failure. So why is it called the silent killer? It is because the early signs and symptoms are unnoticeable. The early signs and symptoms are unnoticeable, and the brain and the damage that is caused by high blood pressure will build slowly. The organs will become affected silently, and we have mentioned the organs. We have the heart. The heart will get affected. The brain, which is a vital organ, your kidneys, your eyes, and many other organs will go affected. And then detection is very late. Detection of these problems is very late. And These will lead to very severe complications. So that's why it is usually called a silent killer. That's why it is usually called a silent killer. So what should you do in order to prevent the silent killer, that is high blood pressure? You should check your blood pressure regularly. You should always check your blood pressure regularly. You can go to the hospital, or you can have your blood pressure monitor at home, whereby you check your blood pressure regularly. Reduce salt intake. Reduce the salt intake. This will lead to the problems with the system that is known as renin, angiotensin, aldosterone system. Then exercise consistently. Exercise is medicine. Exercise is medicine. Then maintain a healthy weight and follow medical advice. So here we have a chart that demonstrates the lifestyle medicine that you can take. One is to exercise. So exercise regularly. Exercise regularly. Then with nutrition, I have mentioned that you should reduce the salt intake. Then avoid risky behaviors like smoking and alcohol use. This will lead to liver lung damage. Then you should get enough sleep. Then also manage stress. Then if you have all these problems, you should seek social support. Thank you.